Welcome to this session of the PlantPure Summit, co-sponsored by PlantPureFoods.com. I'm Ron Gandiza, and our guest expert is Dr. Ted Barnett. Dr. Barnett has been a practicing board-certified radiologist for over 30 years and is board-certified in Vascular and Interventional Radiology. Ted was the principal author of Development of Symptomatic Cardiovascular Disease after Self-Reported Adherence to the Atkins Diet, published in 2009 by the Journal of the American Dietetic Association. And he's also the CEO and founder of the Rochester Lifestyle Medicine, PLLC. He has also long served as the co-coordinator of the Rochester Area Vegan Society. Welcome, Ted.
Thank you very much. It's great to be here.
Now, how long have you been plant-based, and why did you go plant-based?
So our family became plant-based back in 1991, so over 25 years ago. We've been interested for a while. I was interested for environmental reasons. My wife was interested in the animals. But it really was when I learned about the medical reasons that I made the switch. And I read a book by Dean Ornish called Reversing Heart Disease. And in that book, he describes his landmark research demonstrating that heart disease can actually be reversed and that arteries can be opened up on a plant-based diet. And it was tremendous research. I mean, he had angiograms at the beginning of the study and 1 year into the study showing that arteries actually opened. And when I was in medical school, I remember thinking that plaques were made out of concrete. You know, they weren't going to go away. You had plaques in your arteries, you're stuck with them. But it turns out that plaques are actually kind of a dynamic situation. And if you can change the factors in your blood so that there's more going out of the plaque than going into the plaques can actually shrink. For the most part, plaques aren't going to go away completely, but they are going to shrink enough so that they won't matter anymore. And since the resistance to flow in an artery varies as R to the fourth, just a tiny change in the diameter of an artery is going to make a huge difference in the amount of flow through that artery. So that was the book that kind of opened my eyes, and I had kind of an aha moment because in his book, in addition to talking about the study, he also talks about how difficult it is to get money for research into lifestyle interventions because that's just not where the money is. And I realized that at that point that I wanted to make that change myself, partly to see if I could do it and to see what it was like, and also because I thought it was really important for my health and my family's health. And so we all did it at once. We had at the time 2 little girls, and Nathaniel was on the way. So Nathaniel's been plant-based since before birth, and the 2 girls, yeah, exactly. So and he's 24 now. The girls are 27 and 29, and all 3 of them live in New York City, making a living in music. And it's been a great decision to do that.
So, what's been the biggest change that you've seen from back in the day, 20 years ago, compared to now when people talk about plant-based or being vegan?
There's no question. The biggest change is just the awareness. So that many physicians are now aware of this in terms of the health benefits and also in terms of whether it's possible or not. I think even 25 years ago, there were a few doctors who kind of knew about it but just didn't think patients would do it. Just the way they would say, well, patients won't quit smoking, so I don't think I can get patients to change their diet like this. And now we have many physicians who really understand that it's practical and possible and in some ways essential for the survival of the healthcare system and survival of our nation, actually.
So you've seen more and more doctors be educated or at least open to the idea of plant-based nutrition maybe to be used in treatment.
And there's so much more there. Yeah, I think a number of us have gotten out there and have made our point about how important this is. And there's so many more educational resources now. And there's great resources like nutritionfacts.org with Michael Greger. When I made the change, Michael hadn't even entered medical school. As far as I can see, he would still have been in college at the time. So he was an unknown then. The people who influenced me, who well known at the time, I would say Neil Barnard, who was just becoming known. He had started Physicians Committee for Responsible Medicine a few years before that. And of course, there was Dean Ornish. And John McDougall, who's been doing it forever, and Michael Clapper, another physician who's been doing this for a long time.
And all of them are part of this summit. So we're very blessed to have all of the legends, if you will, who've inspired people like you to be part of this. Now, what do you consider the key to success then in going forward? You've seen the past. Going forward, if in a perfect world, what would you want to see happen to get more doctors involved, or more, even healthcare systems, not just the doctors, but the healthcare systems?
That's a really interesting question. So, well, one of the things that I did just last year is I started a company. It's actually a medical group. It's called Rochester Lifestyle Medicine. And I still make my living practicing interventional radiology and diagnostic imaging in private practice in Rochester. But I also have this medical group that's now 6 other doctors, 4 nurse practitioners, 3 physician's assistants, and a total of 30 people all involved in healthcare, and all of whom get the message. And we're out there trying to teach lifestyle medicine. As when I say teach, basically lifestyle medicine is about education. It's not so much about intervention. It's not so much about drugs and surgery, which is kind of the paradigm for modern medicine. What it is it's about having people take responsibility for their own health and learning better ways to eat and better ways to take care of themselves. So as far as the ideal situation, I think it needs to be recognized by the medical establishment that this is the way we need to go. And that's going to be difficult because the medical establishment is it's a large organization. It's a big bureaucracy. And it's, I think, hard for individuals within that system to see their role as far as making changes. So I'd like to see other doctors kind of take on that responsibility the way some of us, have done. Say, okay, I'm tired of hearing people say, well, who's going to, why don't they do this already? Why don't people know about it? Why aren't they doing anything? Well, I think a lot of people in the summit that you've gathered together are those doctors who do get it and are trying to make that difference.
Now, when you have someone that comes into with your group now, right, the Rochester Lifestyle Medicine group,
right,
and they're so used to doctors saying, here's a pill,
right,
here's a pill, here's your treatment, go get your prescription and call me, basically take 2 aspirin, call me in the morning, type of
right.
thing. What's their reaction when you actually say, well, here's what we mean lifestyle medicine, and here's my recommendations? What's really their reaction to you? What you say?
Right. Well, that's interesting. Pretty much all the people who come to us now know what to expect. They know they're going to be, not being given the message about drugs and surgery. In fact, they're there because they want to avoid getting surgery or avoid going on medication or to cut back on their medication. So the people who we see now, they're not so surprised. However, I do take the opportunity when I'm working in the hospital. Just last week, I was taking care of a number of patients who had bad vascular disease and bad arterial disease. And I did talk to them about possible changes they could make in their lifestyle. And I tell them about our organization and tell them, when they get out of the hospital, that they and their spouse or significant other should come visit us because this is a chance to actually reverse things. And, we're already seeing amazing results. This is not uncommon, but one of our patients just last week said, I'm off my insulin now. So when was the last time a diabetic was told they could cut back on their medication? We call that deprescribing because type 2 diabetes is an absolute epidemic. And now we're telling people that, instead of you being condemned to a lifetime of more and more medication and more complications, if you follow our instructions, perhaps you'll actually be going the other direction with fewer medications. So that's pretty exciting, actually.
I'm curious because you're still working in the, hospital system, in the healthcare system. What do other doctors that are not plant-based, what are some of or do they even bring up their objections or concerns to you?
So that is a really interesting question because I have been talking about this for many, many years among my colleagues, and for the most part getting dismissed or people making jokes or making fun of it. Just last week, though, a nurse brought me a chart, and the chart was filled out by a cardiologist, and in the note, the cardiologist said, perhaps this patient should go see Dr. Barnett and his CHIP program, his lifestyle program. And so it's gotten out there, and people are actually referring us patients. And that's exciting.
Well,
So,
you mentioned that a lot of people that come to see the Rochester Lifestyle Medicine group already know of the lifestyle changes, or at least are aware that they're not necessarily going to be given a prescription.
right.
How do they know about your organization?
How do they know? Well, another interesting question. So, as you know, my wife and I have been running the Rochester Area Vegan Society for 25 years, or 20 years, I guess. And we have a lot of contacts through that, several thousand contacts actually. And we put on events all the time. So for example, it's just been about a year since we showed PlantPure Nation at the Rochester Academy of Medicine. And we had several hundred people come to that. And the year before that, we had we showed forks over knives, or a couple of years before that, I guess. So we've had showings of forks over knives. We've had showings of escaped fire, and we now have a lecture series actually going on at the Academy of Medicine in Rochester. It's a wonderful symbiotic relationship that we have with them. So this last spring, we started the Lifestyle as Medicine lecture series. And our first speaker in March was Dr. Michael Greger. And then in April, we had Dr. Neil Barnard. And then in May, we had Dr. Caldwell Esselstyn. And in June, we had Dr. Tom Campbell. Now we took the summer off, but we're starting up again in September. In a couple of weeks, we have the chief of cardiology at a big local teaching hospital. We'll be talking on his personal experience becoming plant-based, because he took the course. I teach a course for clinicians. It's a 6-week, 12 CME course. We'll be giving it for the 10th time this fall. Well, he took the 9th version of it with 75 people enrolled. And the chief of cardiology at Highland Hospital took the course, is now personally plant-based. He's lost 57 pounds himself, and he's referring his patients. So you just have to keep working at it. We're kind of incessant. We keep making noise.
Tell me more about that course.
So the course, we've been teaching it twice a year for, it must be 5 years now, because this will be our 10th time. And it's 6 2-hour lectures. We give it in the evening. And we've taught it at local, initially we taught at the local Jewish Community Center. And then we started teaching it at Unity Hospital and Rochester General Hospital, and then Highland Hospital. We're going back to Rochester General Hospital again. But we went through the process of getting it accredited for CME, which is the official, form of accreditation, continuing medical education for physicians. Through the University of Rochester, we went to them and presented our curriculum, and we got the whole thing accredited. So doctors and anybody else who's a healthcare professional who takes it gets 12 CMEs. And it's actually, it's 12 hours. And each of the hours, 2-hour sessions is broken up into 2 lectures. And in between, we have a break. My wife gives everybody food, and people really enjoy it. So, yeah.
Well, it's interesting that you do that. You do a couple of things, right? You work at the hospital, of course, but you've got your own medical group. And then you do the outreach, and then you do the classes. And you've done so much together, and they all blend together very well. Like they're feeder systems. When one person comes in from one angle, the one door, they end up being led to another door.
Right.
A couple of the other things that you do.
Yeah.
Now, what do you see as where do you go now? Like with the future, you've got the medical group, and I got to tell you, having met you at Summerfest in Pennsylvania, in Johnstown, Pennsylvania, and I think you said you were been there 22, like your 22nd time, right? That you've been there. You're pretty much a legend there, right? Everyone knows you and your family because your kids have grown up, they've seen them, and I'm curious for the future. Have you thought about helping others and their families to become and create more of a family type, because you're such a role model?
Sure. Right. Through the Rochester Area Vegan Society, we definitely already do that. We've been doing that for many years. I would say right now my role has changed, and now I'm doing it more in medicine, and I'm trying to establish a precedent in the medical system. And trying to be a role model for other doctors right now. So the goal of our new medical group, Rochester Lifestyle Medicine, is to establish a model for physicians going into practice that would make it attractive so that they would actually choose lifestyle medicine as a form of practice. Because right now, there's really no good precedent for how the reimbursement works. The insurance companies haven't really worked this out very well. So we are working closely with our local Blue Cross Blue Shield insurance company and attempting to come up with ways to make this a viable model, a financial model. Because of course, if people can't make a living at it, they're probably not going to do it. It's nice to do it as a hobby, but honestly, it won't be respected if it's a hobby. It's got to be right there in the a respected part of our medical system. In fact, it has to become a large part of our healthcare system. So, in answer to your question about where I'm trying to what kind of model we're trying to establish, it's really at this point I'm trying to model for other healthcare professionals.
Well, we've seen a couple different groups, especially with some of the speakers that we've had on the summit, talking more about them establishing practices, setting up medical groups just like you have done, because they've got more leeway. They've got more control over what they can do. And do you see that as within the bigger systems, what do you think would help to get them to be more open to instituting more plant-based techniques?
Well, I know the Kaiser's has been open to this, and they've published a few articles, and that's important. They're the largest HMO in the country, mostly out west, and we have a little Kaiser presence, I guess, on the East Coast. What will make them more open to it? Well, one thing is when people who are important in the system also just recognize that their own health can be improved by going this route. There's also the idea that somehow it could save money. We know it can. It's a little harder. It's hard to imagine why that isn't more effective at this point, because you would think that this would be far cheaper, and well, it is far cheaper. But the question is whether the system is adapted to adjust for that. Mm-hmm. And I think it's coming around.
That's interesting, because even for PlantPure, we've seen the same thing with the financial incentives for hospitals as they start to explore and see some of the issues with more people going to the emergency rooms and having problems there, dealing with this flood of people and really not getting any more money for that. They're trying to find ways of stemming that flow of people that are coming in and taxing the resources for the hospitals, and they're losing money. So they're trying to find financial models that help the hospital. Ultimately, it's a business; it has to be run and support itself. But until they find a solution for all these people that are coming in, growing, it's not like people. The obesity is declining; it's increasing. So it's only going to get worse. Sure, the growth rate, but it's going to get worse. So we've also been approaching it the same way of showing, well, here's what the hospitals could do in terms of wellness. And I'm curious, what's your feeling on that sickness, right? Of the practice of taking care of sick people versus the preventative techniques for that. Do you see that increasing within the healthcare systems, focused more on wellness?
Well, I have several laws of medicine, and Barnett's second law is that nobody gets credit for bad things that don't happen. And that has to do with prevention, because if I prevent something bad from happening, it's really hard for you to be convinced that I actually did anything. I mean, when was the last time you got up in the morning and said, wow, I'm really glad I didn't get polio. Thank goodness for Jonas Salk. It's just not that exciting.
Right.
And there are no television shows about prevention. There are television shows about ER and hospitals and OR and that kind of stuff. So it kind of makes sense. If you're driving down the highway and you don't have an accident because some clever engineer put the right bank into the road and you made the turn safely, you're not going to be thanking that engineer. You don't even know who he was. On the other hand, if you have an accident and an ambulance comes and rescues you, you're very grateful to the person in the ambulance and the hospital they take you to, because it's clear they've really helped you. So prevention is it's tricky for a lot of reasons. I just think emotionally, humans are not really designed to really understand that very well. So it's actually quite helpful that we're in as bad shape as we are, because the fact is that about 75 or 80% of our healthcare costs now are related to chronic disease, and people are generally very, very sick in our culture, in our country. I mean, I'm amazed that you already pointed out that the obesity is an epidemic. Well, it turns out that now 2/3 of Americans are either overweight or obese, and a lot of them are feeling the effects of it. So when you can bring them into a lifestyle program and they get better in a week or two, they recognize that. If they never got sick to begin with because of something you did, they might not appreciate it. But the fact is, they're feeling lousy. They come to you, and with some very simple techniques, they get better. They can understand that what you did is what got them better. I think that's important.
Now, explain lifestyle, because I know a number of people tend to think, at least when in the summit we talk about plant-based nutrition a lot. So, but lifestyle medicine really doesn't just encompass nutrition, right? What are all the elements that define lifestyle medicine?
That's a great question. The Academy of American College of Lifestyle Medicine does have kind of a definition, which I don't have in front of me at the moment. But basically, it includes anything that's not surgery and not medication. So it's going to be nutrition. It's going to be exercise, movement. It's going to be stress reduction, so yoga and meditation, that type of thing. And one of the things we teach, we use the CHIP program as our curriculum, the Complete Health Improvement Program. And one of the things they teach is forgiveness. And, there's social support. In some ways, it doesn't really feel all that medical, what we do, because we do sort of simple social things, like we give people friends. I mean, really.
Well, talk about the CHIP program, because we actually have Hans Deal, who is speaking at the summit as well, who is the founder of CHIP. Right. But explain more about how you've implemented the CHIP program and really what's part of the CHIP program.
Right. So we're very grateful to Hans Deal, and he's been working on this for 25 years. And for people who don't know about the CHIP program, it originally stood for Cardiac Health Improvement Program, or CHIP, and then it became the Complete Health Improvement Program. Luckily, it has the same acronym, and it's out of Loma Linda, California. And Loma Linda is a blue zone. And for people who don't know what a blue zone is, blue zones are places in the world where people tend to live to be 100. So Okinawa, Japan is a very famous one. Sardinia, Italy. And what these places have in common is most of their calories come from whole plants. They also have tremendous social support, and they get plenty of exercise. Not necessarily exercise like running or weightlifting, but they're outside moving a lot, working on their farm or whatever. So Loma Linda, interestingly enough, is a blue zone basically because that's the home of the Seventh-day Adventist Church, and as part of their teachings, they have healthy practices. So they tend to also live to be advanced age. There's a very famous cardiac surgeon in Loma Linda who's, I think, about 99 years old now, who just retired from performing cardiac surgery when he was 95. And there's some great videos about him on YouTube, and National Geographic interviewed him. But about the CHIP program itself, the reason we chose it as our curriculum is that it's very scalable. So right now, the real problem with lifestyle medicine is it requires a lot of time from the practitioner sitting down one-on-one with the patient and explaining what's the best thing for them. So it's a lot quicker and easier to give somebody a drug, right? And that tends to be what happens. Doctors don't feel good about that, but that tends to be what happens, especially when they're in a system that requires them to see a patient every 10 or 15 minutes. So CHIP is based on these standardized videos that are based on the curriculum that Hans Deal developed over the last 25 years. And I don't have to be there when they're being delivered. We have 30 trained facilitators. I'll say that again, 30 are people in Rochester Lifestyle Medicine are trained as facilitators in our group, and they can spread out around our surrounding area to to teach CHIP programs. And in our groups, we have between 18 and 24 patients in each group, and we're treating them as a shared medical visit. And we're billing them to insurance companies as a shared medical visit. So that's basically the financial model. The CHIP program itself is wonderful. It's completely plant-based. It does have a lot of other features to it that include exercise, stretching, meditation, stress reduction, and forgiveness, as I said. And not only that, but the videos are made in Australia, so the people narrating it all have very cute accents.
And they've got like 60,000 graduates, if I'm not mistaken.
They have. A lot of graduates. And thanks to Hans Diehl, who's really worked hard on this.
So you've got the medical practice, of course, or the group, Rochester Lifestyle Medicine, and then you've got RAVS being the support, and then you've got the actual program CHIP, really providing that continued support even after.
Right. So actually, RAVS is not part of that.
Oh, is it?
RAVS is completely separate. That's the Rochester Area Vegan Society. And we have lots of people who come to those monthly meetings. And actually, we even have there's an oil-free vegan group that's part of RAVS. That's basically the Esselstyn program. But that's all totally voluntary. It's a nonprofit. It's volunteer. Whereas Rochester Lifestyle Medicine is a medical group that's separate from RAVS. The social support from that comes through what's called Club CHIP. So that's a month after patients go through the initial 18 sessions of the program, then they're in Club CHIP. We actually refer to that as the CHAMP program, which is the CHIP Alumni Maintenance Program. So once you are done with CHIP, you become a CHAMP. And I know it sounds a little corny, but it's remarkable how much people love it. We have patients who are, as the initial 18 sessions start to wind down, they say, what are we going to do now? We're going to miss each other. What's going to happen? We tell them, don't worry, we have lots of other things for you to do. We've got the Club CHIP meeting once a month. We also have field trips, and we have yoga for you can keep doing, and we have cooking classes. So we keep people involved, and we keep people supported.
Oh, excellent. So, and how long has RAVS been around? I think you've changed the name, right? It was another organization, or?
Well, originally it was the Rochester Area Vegetarian Society, and it was founded in 1989. So it's about 27 years old, 30 years old. Well, let's see, how long is that? 27. Yeah, 27 years old. And we took it over in 1995, so we've been doing it for over 20 years. We just changed the name. So from Rochester Area Vegetarian Society, it's always been vegan. It's never been anything but totally plant-based. Mm-hmm. But the word vegan has always been a little bit problematic. So we waited till about 2 years ago to actually change the name to the Rochester Area Vegan Society. So I'll actually address that right now. So we call it the V word, vegan. And some people are scared off by that. Fortunately, fewer and fewer people are scared off now because they've heard good things about it. But they don't want to become one of those V people. So when they're dealing with us from the medical standpoint, we use the term plant-based. And then very quickly, I'll talk about problems with the V word. And people appreciate that. I think after they get past the first couple of days, then they can sort of accept that vegan's an okay word. You can be a healthy vegan or an unhealthy vegan. And when we're teaching plant-based nutrition, we're trying to teach people to be healthy vegans, which is a whole food plant-based diet. Because of course, you can be a vegan and eat potato chips and soda, and that's not very healthy. Right.
Well, I'm curious because when we were talking earlier and talking to doctors, some doctors immediately say, well, I'm plant-based, and plant-based could be, well, I'm 60% or 70% plant-based, and the other 20 or 30% I eat meat. But when we say plant-based versus vegan, that stigma is going away. I mean, we see it now, right? With the meals in the grocery stores, they don't say plant-based, they say vegan. So it's more accepted that way for it. So, but you're very frank with it. You didn't say, oh, well, I'm a plant-based doctor. You immediately said, well, I'm a vegan, and I've been vegan for so many years. So you do not have a hang-up.
I don't personally have a hang-up with it, no. But I understand where it can be tactical. When you first introduce a patient to it, you don't want to scare them off.
Right.
I don't want to be deceptive about it. So after I have the conversation about plant-based, I'll very quickly explain that I personally am vegan and that I think, you shouldn't be eating any animal products. Really, you can make the argument entirely on health grounds that people shouldn't be eating any animal products. And, if you look at the China study, Really, there was no health benefit at all to eating any animal products, and there was harm for the most part for any animal products in the diet. So, it's interesting, but I also think that from a medical standpoint, what's one of the hardest things about getting someone, once they've made a kind of a change like this, what's the hardest thing? The next thing is them staying with it. So when people say, I've lost all this weight, I'm on this diet, well, what happens? They fall off the diet and they gain the weight back. Well, first of all, we don't like to call this a diet. It's a way of life and it's a way of eating. But second of all, if people are motivated by things other than health, that often will help them stay with the program. So when they learn that, from an environmental standpoint, it's much better for the planet. And what's the point of teaching people a great diet if it's not sustainable?
Right. So, Dr. Barnett, where can people get more information about Rochester, especially so you have a number of health professionals here wanting to learn more about how they can do the same thing that you're doing? How can they contact you?
They can reach me personally at drveggie@gmail.com. I'm happy to share that. That's drveggie @gmail. They can take a look at our website, which is rochesterlifestylemedicine.com. And you can also reach it through the abbreviation, which is RocLifeMed, RocLifemed.com. And when you go to our website, take a look at the page that says Our Team, because it shows all the people that are associated with us. And I'm really, really proud of them. We had them all trained as CHIP facilitators about a year ago. Well, it'll be a year ago in October. So last fall, the people from Loma Linda, from CHIP Central, I call them, CHIP Health, they came to Rochester and trained 30 of us. And usually when you want to get trained as a CHIP facilitator, you have to go to a conference or a meeting where CHIP is present and you stick around for an extra day and you get the training. But I said, I'm really only interested in doing this if I can go large scale. And I can explain why we decided to do it that way.
Yeah, please do.
I'll explain that right now. So about a year and a half ago, I was approached by a local businesswoman who had lost 60 pounds. And you would never guess it. She looks very, very trim. And she was anxious to teach CHIP herself. And she wanted to start a small program. So she came to me and asked me if I would be the medical director for her small group, basically just her. And I said, no, I'm not interested. And so, because I'm really busy and I already teach this, I teach this course. Plus, at the time, I was studying for my interventional radiology boards, which I have to be renewed every 10 years. And I really, really wanted to focus on that. But anyway, she was persistent and she kept coming back. And I said, April, I teach this course that I've told you about already, the plant-based nutrition course, and I reach about 100 people a year because we give it twice a year and about 50 people take it. I mean, last time 75 people took it, so that was a little high. But then I started thinking, if there's over 1 million people in the Rochester area and 10% of them have diabetes, that means there's 100,000 people with diabetes. And pretty much anybody with type 2 diabetes is going to benefit from what I teach. And if they could actually do it, that would be great. Well, so I thought, okay, what's different? Well, the CHIP program is scalable. I don't have to be there. Not that I don't want to be. I love being there with the people. I mean, it's really fun and wonderful, but I can't see more than about 100 people a year that way. But if we use CHIP, we can see thousands of people a year, maybe even tens of thousands. Because at 100 a year, if there's 100,000 people, it'll take 1,000 years to see them all, and even vegans don't live that long. So that's when I said to April, okay, I'll be your medical director, but we're doing this as a partnership. And we are going to set it up so that we have lots and lots of facilitators. So that's when we got many of we already had a list of plant-based healthcare providers in Rochester because of our association with the Vegan Society. And so we approached them, and more than half of them said they wanted to come and get trained. And then we had social workers come, and dietitians and nurse practitioners and physician's assistants. They all wanted to get trained. So that's why I'm so excited about this page that has all the people who were trained as CHIP facilitators. And then on top of that, we had some other very well-respected physicians in the area come to us after we got kind of established. And a woman, Susan Friedman, who's a professor at the University of Rochester, who's very interested in geriatrics and is publishes constantly. She's very well published. She came to me and said, Ted, are you interested in having someone look at your outcomes? And I said, are you kidding? That's great. Of course. So she is now our director of clinical research. And she has actually taken a sabbatical now to study plant-based nutrition and has become plant-based herself, and that's fabulous. Another local physician approached us who is a fertility doctor, and she does GYN. She said, I'm tired of telling patients they're infertile because they weigh too much. And so she's joined our practice. And that's Dr. Rosalind Hayes. And she's now heading up our corporate health and wellness section, and we're trying to go into self-insured groups that can benefit from having the CHIP program. So it's been kind of snowballing in a good way. We're also spreading out to Buffalo to the west and Syracuse to the east. And yeah.
Really?
Yeah, exactly.
So you've got an expanding program, more and more people, more and more medical professionals recognize this and wanting to get involved. It's one thing to recognize the power of plant-based nutrition,
right.
but to actually say, I want to get involved. How do I get involved?
Right.
I can see it. And what will be your classification? Has the improvement been happening for years, like 10, or do we, because I'm curious, it seems to me like there's an acceleration over the past few years. Like it's just maybe 2-3 years, all of a sudden we're seeing a bigger or, a bigger influx of people just really, it's snowballing, as you just said.
Right. It is taking off. I think of it as it's a wave about to crash on the beach. Well, you're from Hawaii.
A tsunami, as I call it the plant-powered tsunami. That's the name of my book.
Yeah. I really do feel as if this wave is about to crash on the beach, and we're kind of reaching a critical mass where people understand it and how important it is. And the question is how to do it from a practical standpoint. So I don't want people to get the idea that we have worked out all the kinks, because we haven't. We're still not really making money. For it to be an effective model, that has to take place. But I think it's going to happen soon. We're trying to do it through insurance rather than outside of the insurance. We want to do this in the system, because if we're not taking insurance and we're outside the system, then many people won't be able to be benefited by this. So we're doing the hard work of doing it within the system. And I know you're interested in computers, and we're doing a lot of stuff in the cloud. So we have an electronic health record system called Athena Health, which is, what I tell people is, if you have a laptop and a Wi-Fi connection, you have a doctor's office. So we can see patients pretty much anywhere. And all we have to do is hook up to our electronic health record and start seeing people as a medical encounter. We have lots of other things in the cloud that you might imagine. We have forums for each group of patients. Each group sticks together, and they have their own forum on our website where they can trade ideas back and forth and communicate with each other. And they have their own little directory so they can keep in touch. And they invite each other over for parties and birthdays and meet each other for meals, that type of thing. So we're using the cloud. We're using a lot of things that were tools that weren't available, 5 years ago.
I think that's the key there. If I were to classify in you and what you've been doing, and as I said before, in going to Summerfest and hearing stories about you and your family and what you've been doing, of course, we've been talking here and there with Ravs and PlantPure Nation, and it seems like you're a very innovative person. You're always looking for ways to do more with less. Mm-hmm. And if that was the theme, and all of the different components you put together, even if they're somewhat separate, like Ravs is separate from the medical group, but they do end up having synergy, with each other. And the CHIP program, of course, being part of that as well. So kudos to you, Dr. Barnett. I think I hope we can share more of this innovative approach with others, around the world, not just within the U.S., but around the world.
I'd be happy. Great, yeah.
Excellent. Again, thank you so much for being part of the summit. Really appreciate it.
You're welcome.
And for all the members here, for all the people watching the summit, if you want to learn more about Dr. Barnett, like I said, Dr. Veggie at gmail.com. He seems very open to your questions there. And don't forget to learn more about the efforts of PlantPure Nation. Just visit plantpurenation.com. Again, Dr. Barnett, thank you so much.
Thank you. It was a pleasure.